On August 24, 2010, Depuy Orthopedics, a subsidiary of Johnson & Johnson, announced a global recall of the ASR XL acetabular system. This total hip replacement had been sold in the U.S. for over 10 years. Also recalled the Depuy ASR hip resurfacing system, a partial replacement, only approved for use outside the United States. This action was taken by Depuy in the U.S. months after having done so abroad, exposing hip implant recipients in the United States during that time to unnecessary risk, where a defective and dangerous implant would be used because the worldwide recall, including the U.S., had been delayed. The recall was initiated following a study which showed that the Depuy implants were failing within just a few years of being implanted, although they were supposed to last 15 years or longer. And recipients of the Depuy Pinnacle acetabular cup system have been complaining of symptoms related to hip implant failure. Many of the patients receiving Depuy hip implants suffered from severe pain in the hip implant area, stiffness and swelling there, followed by popping and grinding sensations in the implant, which interfered with their ability to walk, stand, or sit for long periods of time.
Take your time, keep it straight. Keep it straight.
These symptoms often worsened over time, resulting in severe disability, requiring revision surgery and additional hip replacement procedure. And other hip implant manufacturers are involved. Also recalled the right hip implant device. If you have one of these hip implants, you may already have been contacted by your doctor asking for a blood test, or from the manufacturer itself, like Depuy, or by Broadspire, Depuy's agency that is adjusting claims. Be forewarned that they are interested in settling with you as inexpensively as possible. They will offer you a hip revision surgery for free, but often that's all. You sign a release, and they walk away. As this animation, prepared by the nation's law firm, illustrates, the human hip has a femoral head and acetabulum. During replacement surgery, these natural hip components are removed and replaced with a hip implant, in this case with Depuy implants. A metal-on-metal design was employed, with disastrous consequences. In its design, Depuy used a smaller cup, one where the surface articulation stops before the rim. This causes edge load, or stress points at the edge of the cup, which produces friction and shaving of the metal, producing what is known as metallic debris. These tiny particles of chromium and cobalt lead to friction in the hip implant joint, damaging the metal components even further. Additionally, this debris causes an interruption in the flow of fluids into the joint, known as fluid starvation. What results is increased dysfunction of the hip implant and premature failure. As a Depuy hip implant fails, the metal components are damaged and break down. That releases chromium and cobalt ions into the tissue, causing pseudotumors, and into the bloodstream, carried throughout the body. Studies into this health risk are underway. In the future, we will know more about potential future health complications from this toxic exposure.
Feel all right?
Yeah.
Okay, let's slowly move now.
When the Depuy ASR hip implant was recalled, 13% of hip replacement patients had undergone revision surgery within 5 years when their implant failed. As more fail, numbers will rise.
Take your time.
However, with this defective Depuy implant, when it is removed, often the tissue and bone surrounding the implant has been damaged. When the metal components of the implant break down, the chromium and cobalt particles can leach out and penetrate bone and tissue and destroy it, necessitating its removal. This makes hip reimplantation either impossible or the installation more difficult and the replacement implant's longevity reduced. With hip implants, patients are promised a lifespan of 15 years and the possibility of a second or third replacement if necessary, giving someone potentially 45 years of better mobility and reduced pain. If the Depuy implants are failing after just a few years, and the life of a reimplantation is diminished due to damage caused by the defective device, then that person looks forward to potentially less than 10 years of better mobility and reduced pain. If you have one of these hip implants, you will fall into one of 4 categories. Presently, you are having no symptoms, or you are having symptoms, but so far have not undergone revision surgery. Or you had or have symptoms and did undergo a revision procedure. And finally, you have symptoms but are not a candidate for revision surgery. Do you have a defective hip implant? Are you concerned about complications that you are suffering or might suffer in the future? Our firm offers a free evaluation.